Illness in such a kind of hospital is a common problem. The 62% during their life have and suffer of mental illness, and the 48% when they come here have a psychiatric problem, a serious psychiatric problem, and so we need to recognize and treat this problem, and also to not stigmatize this problem, because if 62% has some mental problem, the mean that mental problem, I think that it can happen to everyone in their life, and maybe not all kind of mental problem, but things that can happen to everyone. Is the only things is to not take these things, to not speak with everyone, but maybe to share some problem, some fear, and to ask for help to the doctor, and the doctor had to know a bit about this thing. Then the second thing is we found that depression was the most common disorder, as was already been discovered by the study that did Professor Ndetei in the past. But the important things, we discovered that 1/3 of these patients with depression, they come here, they are depressed, and not major depressive disorder, but bipolar disorder. So they need a different treatment and a different approach, different medicine, not amitriptyline, but maybe carbamazepine. So if not, we risk to switch them to hypomanic state, and it's not good for them. And also, the study gives some information about a quite number of disorders that we didn't know. For example, pain disorder. So we know that a lot of patients have a degree of somatization. They express the psychological problem with their body. So it's good to the doctor to know that. We also saw that all this kind of disease was at least 5%. Post-traumatic stress disorder, panic disorder, obsessive compulsive disorder, also suicidality, common. If we saw a patient that is depressed, it's good to ask about suicidality, and also alcohol dependence. Finally, that is a relevance of this traditional belief. The 12% of people that have physical illness, and more or less the 20%, 25% of people that have mental illness thought that is a genie, a witchcraft, a spirit that caused this problem. So I think maybe mostly with this ethnic group that I show you, but we have sometimes also to ask about these things, because if the patient believes these things, the things are there, and to have a holistic approach to that, a comprehensive approach, we have to ask. If not, they will think that we have not fully cured them. And last, we saw how the patients say the importance and the relevance of social economic factor in the genesis of psychiatric disorder, and also of the lifestyle. Because I think that like 15% say that stress has caused this kind of problem, and we also seen some 3 patients with bulimia, so we can suppose maybe that this also the socio-economic problem and also the problem with the family can be caused by a bit changing the lifestyle of Nairobi of Kenya, the transition to what they call developing, but developing for some things, not developing for some other one, and these things, the stress is not a good thing. So it's being caused also by this kind of transition, this kind of from the past and now. And I think this is a huge problem, and so there is need for some action. So it's good to advocate some action. Unfortunately, the journalist has not come. But in our small and modest structure, I think that we'll try to do something. There will be in the next 4 weeks some training on the local staff. Everybody can come to how to recognize and treat the most common psychiatric disorder that we know now with this data, which are the disorders, and we train the staff about that to recognize and treat them. And I hope that this will be the first step, a small example, that other facilities, other hospitals, and maybe if we will show to the community, to the government, that it is a very good thing, is a first step of a big road, a big way, and maybe I start with the new constitution now. A lot of right, but as say the African Mental Health Foundation, I think the new constitution gives to Kenyans the right to health. But nonetheless, there will be never a real health without mental health. And Asante sana for your attention. Now I will ask to Professor Ndetei to discuss. I didn't do the discussion of this data. I'm not so prepared about the culture, about the country, about a lot of things, so I think that it will be very good listening. And I really thanks you, Professor, because without you, all this project would have not been possible. And yes, and also African Mental Health Foundation to help me. Really, thank you very much. And thank you very much also to Dr. Moreno for having followed this project, for Dr. Njogu, and for the two persons that helped me, Esbon, Achola, and Celeste, in volunteering with us, and Esbon working with her friends. And also to my friends that has come here today and has helped me a lot to do this kind of presentation. Thank you very much. If you want some data, just ask me.
I think I got that.